Hi, my name is MUNOZ, physical therapist here at Balance Physical Therapy. Here today to talk to you about total hip replacements and precautions after surgery. Oftentimes, we have what we call a posterior or posterior lateral hip replacement approach. What that means is a surgeon, they actually take the hip and they take it out of its socket in the back side or lateral side of the hip so they can access it and do the replacement. What that means though is after surgery, we want to avoid a few movements to make sure that we're keeping that hip nice and stable and not having any complications afterwards. So what they do, we can zoom in here. On the operating table, they put your knee into flexion, they pull it inward, what we call adduction, and they internally rotate it, and it gives access for the hip to come out of the back side. Then they have access to do the replacement. But what that means is that side is naturally a little unstable for the first few weeks after replacement. So our hip precautions, we want to avoid bending the hip to 90 degrees or beyond. We want to avoid bringing the knee inward, what we call adductions or across midline. And we want to avoid internally rotating that, especially the combination of those. So what we want to think about is, again, no flexion beyond 90, no adduction, no internal rotation, especially that combination. But what we also don't think about is when we're in a low chair, that hip may go beyond that 90 degrees. So think about the chair that you're sitting in. Sometimes it's helpful to put a pillow underneath so that hip doesn't go too deep or break that precaution. We want to make sure we're not doing any of this crossing of the legs. Again, that can bring the hip into positions that we don't like. And another thing we want to do is make sure that when we're lying in bed, especially on our side, that we don't lie on our side without a pillow, bringing that hip inward or too high. So a simple trick would be to put a pillow between your knees and then simply get into bed and have a great night's sleep. Thank you for watching. Feel free to check us out at balancephysicaltherapy.com. Thank you so much.